Are you ready to jump into some true crime docs, crime thrillers, and more? Check out our website for an extensive list of our favorite movies and shows at thesirenspodcast.com/whatwewatch and find our favorite true crime and thriller books and authors, some covered on the show, at thesirenspodcast.com/author alley. You can even find special deals for Amazon Music, Audible, Discovery Plus, Paramount Plus, Showtime, and even Grubhub. If you're looking to jump in immediately, check out our pinned Facebook post for some streaming service free trials on us.
You're listening to Sirens, a true crime podcast, brought to you by the Sirens Network. This podcast contains explicit content, so listener discretion is advised. The opinions expressed on this podcast are solely the views of the hosts and do not reflect the views of affiliates, associates, or sponsors of this podcast.
This is Sirens,
a true crime podcast.
Gross incompetence or a deranged sociopath. From 2011 to 2013, Dr. Death was accused of injuring 33 out of 38 patients within only 2 years. 2 of those patients died. Today, for our Season 3 finale, I have put together a round table of guests to discuss Dr. Christopher Duntsch, a Texas neurosurgeon with a license to kill. With 17 years of training, how could a surgeon be so incompetent? Or was he? My guests today include, once again, my wonderful husband, Rick Rollins.
Yo.
He is a paramedic whom you have heard on other episodes this season, and I believe his medical knowledge will come in handy on this episode.
Limited though it may be, I am no neurosurgeon.
Secondary, Emma Waters. Tell me you have a degree in psychology?
I do, with a minor in sociology, and I was also a paralegal for about 10 years. So I've got a little legal knowledge.
You did, okay, so you and I both have paralegal skills.
Yeah, some math skills.
Last but not least, we have Bill.
Hello.
Bill has absolutely no medical knowledge.
None whatsoever. I have seen like 2 episodes of House.
You don't even take good care of yourself.
It's
Not
true.
at all.
Or
Not
legal
at all.
knowledge.
Nope.
I think
He's
you're
real handsome.
You probably
Not
have
from
a
the-
warrant out for
I
you.
might.
You wouldn't even know.
I wouldn't know.
Actually, Bill is more like me and likes to stay behind the scenes. He's probably wishing he was just sitting back, just recording this
Is
instead
this
of...
like is this like in the Olympics, but they just have like a regular dude?
Yes, so
Yeah,
Bill is going
I'm
to play
the
an
average
integral
Joe.
part here in this episode because we're going to be talking about so much legal jargon and a lot of medical jargon that we want to make sure Bill understands.
Which I will not. So
Added bonus, Bill does not like gore at all. Cannot
Not in
stand
real
the sight
life.
of blood.
Yeah.
no.
Yeah.
Can't stand the thought of muscle tearing or bone shattering or bleeding of any kind.
It's
So he's
only
gonna
good
love
in the movies.
this.
Yeah.
Yep. So when we describe in graphic detail most of these crimes, Bill's gonna he's gonna vomit on the microphone.
Probably. We're going to start out with Christopher Duntsch's early life. He was born in Montana on April 3rd, 1971, and spent most of his youth in Memphis, Tennessee.
Gross.
That's the real tragedy.
Disgusting.
His father, Donald, was a physical therapist and Christian missionary, and his mother, Susan, was a school teacher, and he is a graduate of Evangelical Christian School in the Cordova suburb of Memphis, where he starred in football. What's happening?
All right.
You're zoning out already?
No,
We're just getting started. So,
all right. So he played football for Jesus.
yes, yeah.
We're off to a great start,
Okay.
by the way.
So he initially attended Millsaps College to play Division III college football. He later transferred to Division I Colorado State University. I have no idea what any of that means.
What in the Kentucky Fried Fuck is a Millsaps College?
I don't know, but it makes me think of.
Is it Ronnie Millsap?
God, I hope so. I hope they have a statue of him
Who
on the
knows,
lawn.
man? Who knows?
Can you imagine? Like their mascot is just a bigger foam Ronnie Millsap.
God, I hope so. That would be great.
So apparently his high school was small enough for him to be the star football player, but when he went to college, a lot of former teammates actually said that he trained really hard, but he sucked at the game. So he actually, I believe, needed a football scholarship in order to stay where he was.
But he sucked at football.
And he sucked at football.
Well, it was just good enough.
Yeah,
Yes.
so he had to return home to attend Memphis State University, which is now University of Memphis. Having exhausted his football eligibility, he decided to switch to a career in medicine, because if you're not good at football, you should be really good at neurosurgery.
It's only two jobs in the world that I know of: football player and doctor.
That's it. That's it. That's it.
Yeah, that's it. So he completed his undergraduate degree in 1995 from the University of Memphis, and then he continued on to an ambitious MD PhD program. In 2010, he completed the MD PhD and neurosurgery residency programs at the University of Tennessee Health Science Center, and subsequently completed a spine fellowship program at the Sims Murphy Clinic in Memphis.
So just to go over that really briefly, how much school is that?
That's
in
a lot of
years?
school.
That's a lot, right?
Yeah, technically...
So I know that to obtain your doctorate, you've been in college for a minimum of 8 years.
Yeah. Technically, by this point, I believe it was 15 years of schooling.
So post-doctorate is residency.
Yeah.
Post-residency is fellowship.
Yeah.
So you got 5 years minimum residency, and I assume 2 to 3 for fellowship.
Something like that.
So
yeah.
15 to 16 fucking years.
Well, he did his surgical residency at the University of Tennessee in Memphis. He spent 5 years studying neurosurgery and a year studying general surgery. So during that time, he ran 2 successful labs and raised millions of dollars in grant funding.
Not too shabby.
Well, here's the deal. During all of that time for his residency, he completed less than 100 surgeries on his own.
I'm sorry?
Typically, a neurosurgery resident participates in like at least 1,000 surgeries.
A general
That's what I
surgeon
read.
Yeah,
participates in
over the course of the
thousands
residency.
of
Yeah.
surgeries.
Yeah,
how did he-
Less than
thousands.
100?
Less than 100.
How did he get away with that?
5 years of residency.
That's a great question. That is a really great question.
You are welcome.
That is insane.
Yeah. Around 2006 and 2007, Duntsch began to become unhinged. According to Megan Kane, who was an ex-girlfriend of one of his friends, she saw him eat a paper blotter of LSD and take prescription painkillers on his birthday. She also said that he kept a pile of cocaine on his dresser in his home office.
Well, that's just careless.
Damn.
Dude knows how to party.
Right?
That's
A
insane.
pile of cocaine?
That's, quote,
What
pile of
constitutes
cocaine.
a pile of cocaine?
Well, I mean, the pile is the
Scarface
status. Like, if
pile?
you just got it in a container, anyone can do that.
Good, right?
You know?
You gotta have a pile, man.
You just have an open pile.
What are the... It goes bump, line, pile?
I don't know, man. I don't do drugs like you.
I would think it's
Big on drugs. I'm
Right,
asking you
yeah.
about bump, line, pile.
And he's doing cocaine right now.
Right
I'm
now.
watching.
Right
It's
now.
So gross.
God.
He won't share.
She also recalled a LSD cocaine fueled night of partying between her ex-boyfriend, and Duntsch, where after the end of their all-night party, like into the sunrise, they witnessed him put on his lab coat and go to work, where he would do surgeries.
all right.
Good work ethic.
You would
right?
think that his numbers would have been higher than just doing all kinds of surgery.
You would think. So he was actually suspected of being under the influence of cocaine while operating during his 4th year of residency training, and at that time, he had refused to take a drug test.
Can you refuse as a doctor?
Yeah, you can
Or
refuse a
training?
drug test at any time,
Well, I mean, like
anywhere.
I know you can just refuse it, but I mean, and then
Doesn't
still
mean there won't be
continue to
consequences.
Yeah.
No.
Yeah.
So
Here's
you
the
get kicked
thing.
out of school?
No, it's true, but neurosurgeons are incredibly well sought after, especially spinal surgeon specialist neurosurgeons.
Yeah. Yeah.
So,
So they're like,
There's-
it's okay.
no, but they're like, it's more of a hassle to put anything on paper for him.
Yeah.
Because they have these accreditations they need to keep with their hospital to be able to tell people that they have a certain level of skill they can provide to the public.
Okay.
So if something gets documented that their lead rock star neurosurgeon is cokehead, you might lose that accreditation. And if you do that, you lose the ability to make money off those massive surgeries. They go to another hospital.
Okay.
Yeah, so what they did, because he refused to test, they just kind of assumed it was true, and they sent him to a program for impaired physicians.
So rehab just for physicians.
Yes, yeah. He remained there for several months before being allowed to return to his residency, but all of his residency after that was supervised.
I guess that's a little bit of an improvement.
I'm guessing somehow he finagled out of a bunch of his surgeries before this, and then when he actually had to be supervised is like where he racked up this 100, because someone's watching it, you know.
Okay.
So I actually have, let me turn this up. I have some audio of his supervisor from his fellowship program talking about his drug problem. We're going to listen to it.
The year before his acute year, he was on my service, and I got a phone call from the hospital administration saying that some woman had anonymously placed a phone call saying that she just wanted us to know that he liked to do drugs before he went to operate. And so I said, well, fine, send him down to Employee Health, come and get his urine checked. And he went down and checked in and said, I can't pee right now, I'll be back in an hour, and disappeared for several days. And when he showed back up, obviously that prompted referral to the impaired physicians group. The rest of his acute year, obviously, he was in a sheltered setting where he wasn't operating independently. He was always operating with an attendant and that sort of thing. So it was just something that made us all nervous.
So that was his previous super.
We want to believe that this man is, I mean, caught and knows he's caught, and this is this early in the timeline.
Yes, yeah.
Like, all right, so we've recognized, because I think it's very important here that we look at not only all the crimes that happened, but at what point they could have been discovered, stopped, and or treated.
Right. I would
So
also...
He's still a student at this point, isn't he?
Yes.
Okay.
That was his
This
fourth
is
year of
day
residency.
one. He's never
Yeah,
murdered a
shouldn't have
human before.
graduated.
Yeah,
Okay.
yeah.
This is it.
I would also like to believe that during that time when he got back from this program that they sent him to and were supervising him, apparently he did not do one single thing alone. I would like to think that those supervising physicians knew that he was doing things correctly, at least.
I would hope so.
Here's the thing on that. Now, a lot of skill treatment in medicine doesn't really start with me handing you the scalpel and saying, okay, go ahead and cut the ilium tissue and repair it back to the
Right.
Lystat. It's going to be
Yeah.
me standing over the body and you standing directly behind me, and you're going to watch my hands.
Right.
I'm going to cut this piece. This is the piece. This is why I'm cutting. This is exactly why. I'm not
Right.
going to let you do this now. I'm not going to let you do this the next 40 times that I
Yeah.
do it.
Yeah.
I'm going to let you do it at around 100 times of watching me do it. So I know beyond a shadow of a doubt that you've seen enough different cases of people
Right.
to still identify these structures.
So when they
Yeah.
say these surgeons have participated in 1,000, over 1,000, thousands, where it's most of them were probably supervised, not actually doing the surgery themselves, or maybe assisting during the surgery, but not performing 100%.
So there's 3 phases of medical training. There's observation, practice, and supervised.
Mm-hmm.
Okay. In the observation phase, you watch me In supervised, I watch you, and then in practice, I watch you and I don't help. That's it. So in the supervised portion, I will literally, it's so frustrating too from a medical standpoint, performing any minor surgical procedure, to have a man standing behind you, touching your hands with his hands and going, no, you're holding your hand weird, like turn it a little bit. Why are you doing it like that? Everything that you're doing.
So like Ghost.
100%, except that it's a human body. One of the
So you can kiss him.
you can kiss them if you want to. Like one of the most commonly used ones that we do in our field is IVs. I mean, it doesn't sound like an invasive procedure, but it is. We take a little needle and we put it in your vein. Sounds easy enough, right? Everyone's body is different. Now, there are landmarks that can show you or guide you towards where a vein should be, but until you recognize the difference with touch, by recognizing it by sight, or recognizing it by different signs. Like, for example, there's this misconception that African American men and women, their veins are more difficult to locate than Caucasian men and women. That's not true at all.
That makes no sense.
The biggest difference that I would say makes it more or less difficult is an overweight person versus an underweight person. That is infinitely easier to find it in an underweight person than an overweight person. And once you've touched enough to know that the antecubital vein in your elbow is always just above your elbow, and you know that spot, you know that landmark, you know where the skin bends, then once I realize you know that, I'll stop telling you exactly where to poke the person, and I will supervise you while you poke the person.
Right.
That point, you're in practice. So thousands and thousands, every day of your residency should be you running room to room to room for 12-hour, 14, 16, 20-hour hospital shifts, following around people that make more money than you, and begging them to let you just watch them.
Yeah.
And you would be so frustrated by how 90% of the time they're like, I don't really have time for your nonsense right now. Can you go stand way over there and watch me? Because I don't need you in my, I don't want you in my bubble.
In my business.
And, yeah. So thousands and thousands and thousands and thousands. Yeah, that should be. Less than 100 is ridiculous nonsense.
Yeah, for 5 years, to be there 5 years and you have less than 100, that's
I can't fathom that. I can't fathom that.
suspicious.
We're going off the assumption that the less than 100 were all observations, probably.
They had to be.
From what I'm about to tell you, I feel like they had to have been.
Maybe he did like a studied phase where he did supervisory and was able to practice in a cadaver lab. Maybe he's counting those.
Okay. Yeah.
But even still, I mean, that is rare to have them just be like, all right, this guy died. Why don't you go practice a whatever on him?
And I'm wondering if each one of these needs to be like signed off on. Like
Absolutely.
every time you perform, like
no, you don't
I would think
understand.
so.
Every single medical skill you ever perform in your practiced or observation phase, you need to have someone else tell an adult that you did it. You
Right,
can't,
so-
they don't just take your word for it.
So my question is, was he forging some of that?
That's what I think.
See, I think he had to be.
Yeah.
I think he had to be.
But how would he go about forging that?
I mean, it's just a signature.
It's just a signature.
But isn't it
a
other
signature, a
people's? Wouldn't it be
timestamp.
the supervisor's signature?
Here's
He's
the
seen
thing.
Well, yeah.
it. He's seen it before.
In the clinical
They've been
portion of it, you
can fall through the cracks.
Yeah, you absolutely
Yeah.
can.
Yeah.
You're not the only resident in this residency program. There might be 30 doctors running
Yeah,
around this
and there
hospital.
probably was. Yeah.
All those papers, they go to one dude's desk, two dudes' desks at max 3.
Yeah.
And so they're looking and they're going, all right, observed by whatever. Because you print the name of who you're observing that day. And in some cases, the sheet will have that you printed.
Here's our guy.
I was with Dr. White. I was with Dr. Brown. I was with Dr. Black. I was with whoever the fuck you were with. And then they just look next to it and they see whatever and a B. And they're like, whatever. I don't care. Because these doctors
it's signed off on whatever.
Well, I mean,
they're signing off on it right after the surgery.
I mean, what do you
right
think they're
after it
going to go
happens.
to every single person and be like, hey, did you sign off on?
no, I thought he
Joe,
had
did
a
you sign off on-"
supervisor following him for his observations.
They do
I don't
from
know.
a desk in their
Yeah.
office of the
Okay.
college.
Yeah.
And you can imagine how well
That's
that's
a good point.
Yeah.
Alright.
Especially how many years ago was this? 10, 12 years ago?
This was 2010. Yeah.
There you go.
So, so
Too much faith in the system, I guess.
Well, I mean, think about it.
that's what this whole case is about.
all of the
Well, I mean, it's just because he was kind of, they were watching him already because of shady, not shady behavior, but
exactly. That's exactly
So
my point. Because
you would think that they would watch him harder, and if you said neuroscientist is so hard to come by, you would think that would be even more eyes to put upon him.
But you have to look at it from a different point of view.
What they thought was, he's still here. He must be doing better.
He must be doing well. And it's not just that. Medical students are some of the most high-stress students you will ever meet in your life.
Oh, I'm sure.
In their mind, they already, pass or fail, have hundreds of thousands of dollars of student debt lined out. So administration has already chewed your ass once. They know that if another piece of paper comes across my desk that has your name on it, you're fucked.
You're burnt.
Well, and you also have to consider
they're counting on your fear.
You also have to consider the fact that he was not reported by a colleague or a supervisor. He was reported by an anonymous phone call that said that this person had partied with them, so they have no way to tell who this person was or where the complaint was coming from. So
who did they call? The police or the hospital?
The hospital.
Yeah.
Wow.
I mean, they'll call your
don't.
residency program, and a lot of that gets swept under the rug because she pissed off her boyfriend.
Exactly.
Called
prank
and
caller.
said, I know she was doing drugs. I check her and they go, hey.
Especially if it was a woman that called, which it was. It was a woman who
Oh.
called. So,
But I thought they were already taking that seriously by
100% did.
They did.
But then
They
they
did.
brought in this nerdy little researcher guy who wants to be a neurosurgeon. They sat him down and said, your whole fucking future's on the line. If you fuck up one more time, you're done. You're out of here forever. So keep it in line.
So it was a threat, and that's all.
And in their minds, they're like, all right, we scared that little nerd. He'll never be back in here. Because medical students, they base their entire futures on this. Some of them are first generation, even college graduates, let alone doctors. So they already know what's on the other side of the desk, the weight that the student is holding. So a cocaine thing like that, I mean, I can't imagine how much they reamed his ass in that room. And it probably, in their minds, now he's sociopathic, so he followed all the rules and played all the roles. Then when he left the office, he could do whatever he wants because he knows what they know. All right, they've scared me. They won't look at my name again.
Okay.
These are people that want to build careers here. They want to start here, and their entire future can be blown apart right there at the base level. So they know that you're going to be on your best behavior.
I mean, he wasn't too worried
It's a good
about it
point.
because he started up a relationship with a woman named Wendy Renee Young.
Oh, Wendy.
They ended up having 2 sons together, and she actually remained with him through this whole entire thing that we're about to talk about, despite all of the things and constant domestic violence from, like she said, constant domestic violence within the relationship. So he initially focused heavily on the PhD half of his degree. His name appeared on several papers and patents, and he took part in a number of biotech startups. When he met Young, Duntsch was already over $500,000 in debt.
Woof.
Yeah.
Good Lord.
yeah.
I mean,
Yeah. So how do you make money real quick? You become a neurosurgeon.
no.
No, you need
You're not
drug
wrong.
money.
Whoops. Oh.
If you need drug money, you got to become a neurosurgeon.
You're not wrong.
That's it.
Get out of debt, get my drugs, become a neurosurgeon. So he decided to turn to neurosurgery. And in 2010, he moved to Dallas. He persuaded Young to come with him, and she agreed. She had actually grown up in the Dallas area, so she wanted to go back home. And upon applying for work, he looked extremely qualified on paper. He'd spent at that time a total of 15 years in training, so medical school, residency, fellowship, and his curriculum was 12 single-spaced pages long. Yeah. So he also claimed to have graduated magna cum laude from St. Jude Children's Research Hospital with a doctorate in microbiology, a program that the hospital actually didn't offer at the time that he allegedly attended. So we're already seeing stuff.
Your forgery argument is starting to
See?
sound
Makes more
pretty
sense,
prominent.
right?
Yeah.
See?
It's starting to sound pretty prominent.
Yeah.
It kind of reminds me of, you remember when Subway used to do the stamps? you know,
Oh, yeah.
on the card.
Yeah.
I used to print those off and get free sandwiches. So.
Oh no, Bill, you
Kind of
admitted
the
that.
same.
People are coming after you. Bill, no.
Bill, you think
Bill,
that
no.
Not like this.
lying
It's
about having
pretty
a
much the same.
doctorate in microbiology,
Subway
forging a card to get a $5 sandwich.
Well, it
Are
just
you
goes to
sorry
show
you
you
invited
that
him? You are
people
right.
don't care. Like,
No, they
they'll
don't
just
give a
take your word at
They
it.
just take words.
It's-
But I think
but
that
no,
the
that's
Subway
actually a good
guys like
point.
Jared
it's
Fogle
$5.
Yeah, people
told
don't
me
care.
it was
No,
5 Subway
but that's
sandwiches.
actually a good point. If you get someone who is just like, man, I've signed 87 of these today. Like, I don't know if I signed his. Who cares? Like,
Just let him in. What's he
Just-
gonna
yeah.
do? Murder somebody?
Oh God.
Oh, he graduated
Oh.
cum laude or whatever. And
Yeah.
whatever. I don't care.
who cares?
Or whatever. I don't care. It's my last week. I've checked out.
Yeah.
I mean, you gotta wonder how many perfect moments like that was
yeah.
it, where they just like, oh, that sounds
Yeah,
good.
just a snowball effect of these perfect. Yeah. So he focused on his research for a while, but was recruited from Memphis to join the Minimally Invasive Spine Institute in North Dallas in the summer of 2011.
That's a big deal. Minimally invasive
Minimally
surgeries.
Invasive Spine Institute. That means not major surgeries.
No, we're talking about mostly they'll do
Inpatient, outpatient.
Yeah,
stuff.
mostly they'll do like
Arthroscopies.
well, kind of, but instead of laying the patient face down on the table and then opening up the entire back to go in and renew and repair anything like that, they'll come through the front of you and make very small incisions, like really small stuff.
I thought back surgeries all came from the front.
Some of them do,
No,
unless
not all
some of them do come through the front. Some come through the back. It really just depends on what's being repaired.
Especially when it comes to disc repair.
Okay.
You go through the back. All right, so after he
I
arrived
don't
in
know how
Go
town,
to the front, you wrap around the heart, then you get out of here.
Well, in the game, he's always laying face up with like the
What
water
game?
on the knee.
Oh my God,
and
are you
the-
talking about operations? Oh my God, no.
No. I had a family member who had some kind of
Bill,
surgery.
stop it.
And they
Touched the sides and shocked the shit out of you.
exactly. That's exactly what happened.
His nose was so red when he came home. Oh my God.
No, and it was some kind of back
God.
surgery, or maybe it was like a kidney or something. But they're pretty much like almost cut in half. They go in from the top. It was whatever surgery.
it might have just been whatever
almost
particular
cut in
surgery that
half.
was.
I guess so. I thought they didn't want to cut the back muscles. Like I
we-
thought that was the thing you didn't
Well,
want to do.
you definitely never want to sever muscle tissue if you're doing bone surgery.
we are going to talk about a bunch of different ones, and they're all performed differently. So, all right. So after he arrived in town, he secured a deal with Baylor Regional Medical Center at Plano and was given surgical rights at the hospital. He joined Baylor Regional Medical Center at Plano, which is now called Baylor Scott and White Medical Center. I don't know why I felt like you need to know that. As a minimally invasive spine surgeon with a salary of $600,000 a year.
Damn.
Good
Plus bonuses.
Lord.
Yeah, and he is right out of college, right out of medical school.
Okay, let's consider now like another point where he could have been stopped. In my mind, Duntsch should have looked around and went, okay, this is a real deal. Like, they're going to turn me loose.
Yeah.
They're going to pay me $500,000 a year to do these surgeries. I don't really know what I'm doing.
He was.
I need to say something.
It sounds like he had.
But he's
that's
too
the-
deep.
But
He's
that's
too
the
deep.
thing. He would never admit that he doesn't know what he's doing because he's a narcissist.
It's that.
As a matter of fact, a lot of people say over, like, we heard him say this. He's told us that he was the best neurosurgeon in town and, like, all this other stuff.
Yeah, it seems
Isn't
like
that
the
the other
bonuses
thing?
and the money just feeding that ego.
100%.
Exactly.
Yeah, that
Exactly.
ego was the problem
you're not,
to begin with.
You're
Well,
not going
that's
to tell
a
anybody.
red flag. There's your narcissism and your
Yeah.
sociopathy shining through.
Let me ask you something about that, by the way, because I don't deal a lot with psych, but sociopathic and narcissistic, the major triggers for that, those are a part of his behavior forever, right?
Yes.
That's not something that like
You
he
can fix.
slowly grew into,
No,
or
those
is that something that a traumatic event triggered that, and now he's just that way forever?
traumatic childhood can cause sociopathy. These traits, they start when you're around 15, and then just kind of like red flag after red flag. So by the time he graduated college, he was like full blown sociopathic, narcissistic man.
So we're already star quarterback at BFE college or wherever the fuck.
Oh, yeah.
Then we went to college ball and got our ego hampered.
Right. And you know what I'm thinking? He also played football for a long time. How many traumatic brain injuries did he have?
Yeah.
And that can also kind of roll into...
Yeah, that's a good question.
Yeah. Would have exacerbated a lot of his mental illnesses.
Yeah.
Well, I will say in his early tenure at Baylor Plano, he made really poor impressions on his fellow surgeons. A veteran vascular surgeon, Randall Kirby, recalled that Duntsch frequently boasted about his abilities despite being so new to the area. Kirby also recalled that Duntsch's skills in the operating room left much to be desired. As Kirby put it, quote, he could not wield a scalpel. Ooh. Right?
But that goes back to the, so many people see... how shitty he is.
Mm-hmm. But man, he could play things.
How does he keep stop him right there?
How does he keep getting, how is he not fired? If someone who's an established surgeon says, you kind of suck.
Right. But there is a difference between working for a hospital or something like that and just having privileges at that hospital.
Yeah, that is different.
So he only had privileges at this hospital, which means that...
Oh, I thought he was working there.
It kind of means they're part-time. He
brings his own clients.
Yeah.
He just,
he's able to...
Yes.
Correct.
Okay.
Or if we have a patient that comes in and all of our doctors are busy, we can call you.
We can make a referral. And this is where he does his surgeries, not where he sees his patients, his initial patients. So he was able to lure patient after patient under his knife with his extreme confidence. Dr. Mark Hoyle, another vascular surgeon who worked with him during one of his botched procedures, told D Magazine that he would make extremely arrogant announcements such as, quote, everybody is doing it wrong. I'm the only clean, minimally invasive guy in the whole state.
Yeah, that screams ego.
Clean like a
I
smells
would be
good.
all right, the only one? Have you been to the whole state, dude?
Yeah.
The only one? There's a bunch of buildings got this shit wrote on the front of it. You don't think somebody else has figured it out, you big four-headed bitch? Look, here's my thing. If you, I've seen supervisory ER docs talk with ER residences. Now, you got to remember, these guys are at the end of their residency. They've been doing this for 8 years plus 5, 13 years you've been studying medicine. And they come into the ER with an ER doc that's been there for 5 years after their residency, so they've been there for 18 years. They've seen, I'm telling you, in a big city ER, it is a magical place where babies are born, bottles are pulled out of butts, and lives are saved, gunshots. I mean, it's insanity what happens in an emergency room. And for any doctor to come in there at the end of his residency to get a brand new job at an ER, you are the rookiest rookie in Rookie Town.
Yeah.
Shut up, stand back. You haven't been to the front lines, dude.
Yeah.
So don't come in here swinging your big old fucking dong around like you own this place. You do not.
So I want to make it clear, at this point, he is working at 2 different places. He is at Baylor Plano.
Sure.
And he's at this minimally invasive spine institute. So he performed 1 surgery at this minimally invasive spine institute and was fired.
Oh my God.
Okay.
You no longer have privileges here.
God.
I don't
How
know.
bad do you have to fuck up?
But that's a good thing. They saw it and they were like, okay, get out.
Well, but here's the thing. He wasn't fired for what you think he would be fired for. So what happened was he did a surgery. Apparently everything went fine, but then he just left and went to Las Vegas and didn't tell anyone about his patient and didn't leave anyone to take care of his patient.
Oh my God.
Did they just go into a room and they're like, this room's supposed to be empty?
Close up, we're going to Atlantic City.
Who's in there? Yeah, so...
With these hands, I can't lose. Waste no time.
So who knows how long that patient was in there not being looked after before.
Jesus.
God, that's
fucking
awful.
I imagine they just turn the lights out.
Yeah.
Low.
Everybody gonna... Uh-oh, it's going back to sleep.
Do I just get up or
Do I have to take aspirin or something?
Can I go?
No one's told me anything.
Nurse walks by. Who the fuck are you? Who the fuck are you?
Get out of here.
Yeah. So
Why's your butt out? See your ass, man. Put some pants on.
So he might have been fired from the institute, but he was still a surgeon at Baylor Plano. Yeah.
Jesus
And I want to
I can't believe those two institutions didn't talk to each other. That's the thing.
Why would they?
But they do all the time. You think hospitals don't talk to each other?
You would think just at
Apparently
least the
not
workers
back in
would
the
talk
day.
to each other. Surely you talk to other people in the medical field.
And I do want to put in here, well, a lot of people don't know that I worked as a surgical assistant for a year here in one of these big old hospitals up here. But I wanted to, for the people who don't know what goes on in an OR, I wanted to let you know who all is in an OR before we start jumping into these cases. When you're in an OR and surgery is taking place, you usually have your surgeon, right? Maybe an assisting surgeon or a PA. Then you got your scrub tech or your surgical tech. You got one or two surgical assistants, which is what I did. An anesthesiologist and their tech. And depending on the surgery, like what kind of surgery it is, you might also have like a cardiac perfusionist, an RN. But it is definitely like a whole ass team of people. They all have different skills. They all have different jobs. When you're in there, though, keep in mind that the surgeon is basically God. You don't talk to your surgeon. You don't question your surgeon.
No.
You hand them what they need to be handed, and that's pretty much all there is to it. For a person to question their surgeon, it's got to be either an outlandish thing is happening that you cannot imagine this surgeon doesn't see, and you have to say something, because people have gotten fired for way less out of the OR for questioning their surgeon. And that is why a lot of people in an operating room do not question their surgeon, and they do not push it because they don't want to get fired.
When I was on my clinical rounds, I watched an ortho surgeon do a knee replacement. There were 8 people in the room, all doing their different jobs, and then me in the corner makes 9, and then the surgeon made 10.
Yeah, there's a lot of people in there.
It's just a knee replacement, is what everybody kept telling me. This will be so boring. It's no big deal. They just cut his leg off, put a robot
Ortho's
leg on.
awesome. It's not boring at all.
It was insane. We won't go into that, but it was banana bread. But I remember during the procedure, the anesthesiologist had an ear pod in.
Yeah.
Now, anesthesiologists are super expensive people.
Yes, they are. Yeah.
They're right under surgeon, but you're still under the surgeon.
Yeah.
He had an AirPod in, and the surgeon, while he was working on the knee right before close, he could hear that guy's music like behind him, and he turned around and he was like, he didn't say his name, he didn't address him any, he just looked in his eyes and said, "Take your fucking AirPod out."
Yeah.
And an anesthesiologist said, "Yes, sir." Took it out, turned it off, put it in his pocket.
And that's
it
the
was,
thing.
It had this weight to it, like the way
It
that he said
does.
it was like, "You will never do medicine again.
Well, and it's
take your fucking AirPod out."
and it's not like
like my skin gets goosebumps right now just thinking about it because it was insane.
And it's not like you have the same team every time you go in there. You might have a different anesthesiologist with a different surgeon. You might have people that's never worked together before. It's whoever is available to go into that surgery at the time, unless you have a surgeon who has brought his own whoever.
Yes.
And
I was going to ask that. Do these people work for the hospital or do they work for the surgeon?
so
like in his
yes,
scenario?
they work for the hospital, and he brings himself to do his surgery with his patient, and they supply the staff because they're going to get an amount of what his surgery is bringing in. So if he charges $300,000 or whatever for this surgery, that hospital is going to get, say, $100,000 for letting him use their facility and their staff.
Okay.
So,
But he didn't have his own staff. Right?
No, he
He's
didn't,
always
no.
using someone else's.
yes, so when he worked at Baylor, he used Baylor's staff and wherever else he went. He never had his own staff. He never had his own surgical tech or, anything like that. So
Still losing it away, games.
yeah. The first patient of Dr. Duntsch was Kenneth Fennell. He was left with chronic pain after Duntsch operated on the wrong part of his back. Due to debilitating pain, Fennell later had a second operation by Duntsch to relieve it, left him paralyzed in his legs.
Oh, man. Jesus Christ.
Fennell required months and months of rehab to be able to walk just with a cane, and was left unable to walk more than 30 feet or stand more than like 5 minutes at a time before he had to sit down again. And that was just jumping into it. The second patient, Lee Passmore. We are now at December 2011, just so you know. A Collin County medical investigator experienced chronic back pain and limited mobility after Duntsch cut a ligament, which was not normally touched during that particular procedure. And that vascular surgeon that I mentioned earlier that said he was really arrogant, Mark Hoyle, he assisted during this operation. And he later recalled that Duntsch seemed oblivious to considerable bleeding. He would later testify that he observed Duntsch cut out a ligament around the spinal cord that isn't normally even touched in the back surgery. He misplaced hardware in Passmore's spine. He actually stripped the screws that hardware would go into to keep it in place. He stripped that screw so it couldn't be moved. He placed those screws in the wrong locations. It made Passmore bleed out. It would have made him bleed out if it would have been removed. So they had to leave it in there. So he became so disturbed by Duntsch's actions during the surgery that at one point he physically restrained him. He later told Duntsch to his face that he was dangerous and that his behavior had led Hoyle to wonder about his own sanity, and that, like, is no one seeing what's happening here? Am I the only person seeing this? He thought that he was insane. Lee Passmore has crippling nerve spasms to this day due to the needless removing of parts of his spine, and he can barely speak without that being prominent in his speech.
The guy that was assisting,
Hoyle.
Would he not make a case at that point for, like, what is it, malpractice, I guess?
So, he could have made a complaint at that point, but really the only person to make a complaint to, he could have made one to Baylor for them to revoke his privileges there. He could have also made one to the medical board.
So tell us about this doctor.
I don't think he did.
Tell us about what this doctor's job was.
This doctor was a vascular surgeon.
Okay.
He was there to assist during the surgery.
In case he puts a screw in the wrong place and it makes him bleed out.
Yeah.
Nice.
He couldn't fix anything because by the time that it had happened, like, he put these screws in the wrong spot and then he stripped them out. By the time that he realized what was happening, it was like, well, you have to leave them in there. He's going to bleed out. They can't be removed.
I can understand all that.
That's
like,
insane to me.
In the moment, and it's like, all right, this guy messed up.
We got to leave it. We got to make it right.
Damage control.
Why there was a third patient?
Yeah, that's what I'm curious about. Is why there was a third patient?
I believe that he did at one point.
Physically restrained him.
Yeah, he did do that at one point. Like, as in, if you don't stop touching this patient, like, please stop and let me finish up because you obviously don't know what you're doing. But then, as a surgical assistant, I'm sitting here watching two surgeons fight each other, and I don't know which one is correct.
Yeah, I'm not laying any blame on them.
Yeah. So, I didn't see anywhere at this time where this surgeon made any sort of complaint about him at this point in time.
It's so weird.
Cutting ligaments, cutting parts of the spine out.
I'll fight you, but I'm not going to tell anybody about it.
Well, I think also that they thought that he was under the influence, so they could think, oh, he's just messed up, but he's a great surgeon when he's over. This is just speculation. Just throw that out there because he was on drugs. So,
well, at this time, no one was aware of that at Baylor Plano.
Okay,
no one was aware of it.
So the first patient we had. Let's talk about the error. What did he do to the first patient?
The first patient was Kenneth Fennell.
And
he cut parts of the back. So let's say point A is where the surgery is supposed to take place.
Sure.
he didn't even touch point A, and he moved over here and was working on point B, and it wasn't even supposed to be touched.
So he cut in the wrong place on the first one.
Yeah.
What did he do on the second one?
So the second one, he cut a ligament around the spinal cord.
Oof.
That's not even supposed to be touched during the surgery at all.
Or ever in your life.
He misplaced hardware. He put hardware in places that it wasn't supposed to be.
And then stripped the heads off the screws
And then,
so he couldn't get them out.
yes.
Almost like he wanted to see what would happen if he...
He also ignored excessive bleeding during the surgery.
Which is the other vascular surgeon's job.
Right.
To go in there and mitigate.
Let's just say...
Hence the fist fight.
Blood pressure. When you have the patient hooked up to all these monitors and everything in there, and there is a blood pressure monitor.
Correct.
There has to be.
So when the patient starts bleeding, you lose blood pressure.
Correct.
That's when that monitor starts going beep, 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 like something's wrong.
And those aren't anything like the ones I use in the truck that just take a blood pressure with the cuff, like at Walmart every 3 minutes.
Completely different, yeah.
This is a different piece of machinery called an arterial blood line. So what it is a small sensor is placed in an artery in your body that constantly, instantly updates the blood pressure.
Okay.
So it's not like he had to wait for a cycle to know if it dipped. No. It's telling him right now, hey, he's dipping.
Live.
He's dipping right now.
And apparently what happened is that when he started dipping, this other surgeon were saying, hey, we probably need to see if there's some bleeding, control that bleeding. And he literally said nothing. He just completely ignored everyone in the room and continued to do what he was doing.
Remember, sociopaths don't have empathy, so they don't understand suffering of others. So they don't get it.
No.
Which is...
Good God.
Yeah.
So to him, it's just a status report. Blood pressure's dropping.
It could be a bug on the floor. He's done his job. Fuck him.
Yeah.
God damn.
But that's a sociopath. So
Jesus Christ.
All right.
Scary.
So we're going to move on to the next patient. This was January 2012. This guy's name was Barry Molgoloff, and he was the owner of a pool service company. He went to Duntsch for a spinal fusion.
Okay.
So this is a procedure that joins two vertebrae together using a metal plate. He got a referral to his pain clinic. Okay. So during the surgery, he was left with bone fragments from this vertebrae lodged into the spinal cord and nerves of his back.
Oh, God.
After Duntsch tried to pull the disc out with a grabbing tool like used by an orthopedic surgeon instead of a scalpel, which he probably should have used. So he's literally
ripping tissue,
ripping a disc out of someone's back,
crushing bone with the wrong,
crushing bone, shattering the bone, and leaving it there. He just left it there, left it all.
It'd be like if we let Bill do it with a fucking pair of vice grips.
Yes.
Get that disc out of there, Bill.
Oh yeah. Hand me that shop vac.
It's like if I told Bill, I was like, Bill, look, this is what a disc looks like. Take it out. And he was just like, all right.
Yeah.
Go get my gloves.
I get it. Almost, it just seems like he wants to see what happens.
Hold my cigarette.
You know.
Do you think that maybe that's the psychological aspect?
That's
of
what
it?
I
He
wonder.
literally knows so little
Yeah.
about the practice that he's just like, let's see what happens.
Yeah, I really do.
That's what I wondered. If he's just doing it to just see.
Yeah.
Could
It's
he
kind
be-
of
Does that
like
imply-
when young children dissect animals. Just
Yeah.
to see.
But does that imply like a almost psychopathic concept there? I mean, you know what I mean? Like
yeah.
he's so disassociated from the patient that he's just like, well, not my dad. Let's see what happens if I yank this out.
But that's
not
the
good.
thing.
Can't put it back.
The thing about it is that he has so much charisma when he's getting these patients. He tells them, I'm the best there is. You're not going to find anybody better than me. I know this surgery inside and out. I'll have you in and out within an hour. You'll have absolutely no more pain when you leave here. He sells them what they want to get them into that.
And that's
that
where
OR
narcissism
room.
comes
And that's
in.
narcissism.
Yeah.
See, this is the dichotomy for me of this Duntsch, is that I don't know if it's a actual ignorance but he's so narcissistic that he's already tasted being godlike. He's already been in that room,
everybody has to do what I say
all the time. No one can question me. So he's got to stay there.
Yeah.
But he doesn't know how to do any of this stuff. So in his mind, does he just go, all right, well, it's surgery time, I got to do something. Like, everybody's looking at me.
I don't know.
He just goes in there and does whatever he wants, and then he leaves, and he's like, all right, you're welcome, I'm the best. And just leaves again.
Yeah, I think he thinks, I'm a scientist. This is science.
And then he just does whatever he wants.
Does it, and he's out.
He's like,
he
you're
doesn't
welcome.
think he can
That'll
be
work.
touched. Yeah.
No, exactly. You're welcome.
Yeah.
That's Dr. Duntsch. Here, I fixed it. You're welcome.
And they're like, okay, but you didn't, though, because now he's dead.
No. You're welcome. And then he just walks out.
Get that body out of here.
Yeah.
Thanks for killing him.
So he also left unused hardware in Barry as well.
That's a huge thing.
Yeah, because, I mean, anything in there that's not supposed to be there, that is considered a foreign object, like a sponge or unused hardware like screws or bolts, anything like that, can cause a horrible infection.
Yeah, how long does it take to get septic from that?
Not long.
Really not long at all.
Not long.
Septicemia can set on with an outside source of infection within hours.
Oh, man.
Like, we've seen patients that just have a Foley catheter back up on them with just a tube that they put in you when you can't pee for whatever reason, your urethra's collapsed or whatever, and it just collects in a bag. Well, if your sediment from your urine collects on the inside of the walls and that plugs, then your waste begins to back up into your body. And we've seen that, completely wreck a person in hours. And that's your own pee. That's not a sponge that was out here. And also, when you were a surgical assistant and they talked about, like, techs and assistants being in that room, do they not say out loud how many sponges are present at the beginning and end of every
Yeah, you have to count everything and go back through it.
Yeah.
So is it like, hey, there's 8 screws and there's only 4 here, and he was like, I'm done.
Time out, though. Time out.
I'm already out.
Because the misconception is that you do that while the doctor's in there. That's not what happens. You set up, so the surgical tech sets up for the surgeon, and the surgeon doesn't even come in until after the patient has come in. So all of this team of people set up everything, bring in the patient, set the patient up, the anesthesiologist comes in. All of this happens before the surgeon ever even comes in. You do your count of your tools and your sponges and everything before the surgeon gets there. But the misconception is that you're going to count that stuff before the surgeon leaves, and you don't. You count that. He's gone. Once he's done, he's like, all right, close up, I'm gone. And he just leaves. You're left to take that patient back to the room, clean up the room, count everything then. So it could be, of course, we try to do it as fast as possible, but it could be 30 minutes later that we're like, there's a sponge.
That seems broken. You can't be like, hey, we're supposed to have 4 screws, we only have 1.
But are you going to turn around to the surgeon and say, hey, you can't leave right now, we haven't counted the sponges? He's going to be like, fuck you, I got shit to do.
Yeah, it's true.
So
I don't know, man. I lost
I'm just
my
saying.
Keys.
Yeah.
Dig them out of this guy for me real quick before you bounce out. There's usually another surgeon that comes in to close, and I guess you could tell him.
But
and that's usually
by
like
that
a fellowship
time,
or a resident.
If you don't count until after that, I'm assuming you're meaning
you
after
usually don't
closed
count
up.
until they're closed and everybody's
Whoa,
yeah.
it's too late.
At least that's how we did it. I don't know how everybody else does it.
That's insane to me.
But yeah. So if and
hardware, not a sponge, a fucking bolt or a screw or a bracket.
And we had to go through the chain of command just to report that. So if there was anything missing, we had to go find our immediate supervisor, which was like the RN on staff. And then she would go to so-and-so, and then they would go to so-and-so, and then they would go to so-and-so. And it's like...
And by then, dudes woke up screaming.
In septic shock.
Jesus Christ.
And then we're like, oh, okay, well, we know where it is now, so... Yeah.
Oh, my God.
We found it. It's poking out of his back. Sir.
Yeah. So during this surgery, there was... I don't know if anybody has watched the Dr. Death series with Joshua Jackson on Peacock yet.
I have seen that.
So
You have seen it?
You did?
No,
I actually did watch a little bit of it when we were talking.
Did you watch Fringe?
No.
Do you know who Joshua Jackson is?
No.
I don't know if anyone has watched that series or not, But Dr. Randall Kirby in that series is played by Christian Slater. And Dr. Randall Kirby, just, I don't know, sometimes you just like to imagine
I think it's just
people.
Slater.
So Dr. Randall Kirby was actually assisting in this surgery. He was the
in the one where the hardware got lifted?
Yes, this last surgery.
And this is the same dude that restrained him?
No.
Okay.
Different doctor, different surgery.
Right.
Yeah.
Right.
So he assisted, and he recalled Duntsch continued making mistake after mistake after mistake, and he corrected him. He even said that at one point he had to point out the correct anatomy during the surgery. He said Duntsch initially refused to give the patient any pain medicine after he woke up in pain, claiming that he was a drug seeker.
After back surgery?
Yes.
Wow, I've never heard of that ever.
And
You're damn right, I'm a drug seeker. Right now, I
Give me
am.
those goddamn drugs.
I want some drugs.
Goddamn drugs, dude.
yeah.
You just cut my back open.
Yeah.
So, and he had lost function in one side of his body. He still requires a wheelchair to this day. Yeah. The patient, Morgulov, later recalled that he walked out on a follow-up visit with Duntsch when Duntsch displayed clear signs of being inebriated during the follow-up visit.
Oh.
Yeah. So
by this time, he's definitely on drugs. And what year is that?
yeah, this is January 2012.
Oh, man. So
What
a
surgery
year
is
after he
this?
started?
This is Barry Morgulov.
Like 3?
This is his
third?
third surgery at Baylor
Absolutely
Plano.
insane. Do you like surgery from the front?
Back to what else. This is the 3rd surgery,
Yeah.
right?
Yeah. At
And
Baylor
it's
Plano, yeah.
the 2nd time that the assistant, I guess.
Kirby's the neuro guy, right? Like, he is the spinal guy.
No. Mark Hoyle and Randall Kirby are both vascular surgeons.
Okay.
And both times, they had to step in and be like, bro,
Yeah.
what
The
this
fuck
is
are you doing?
wrong.
Yeah.
And
Yeah.
he's still, we're going to continue with a 4th surgery.
Yeah, and Randall Kirby, I mean, he was even like, that's not even, I mean, he had to point out, like, basic anatomy to this
And
guy.
he isn't the spinal guy. It's like, that's bone, dude.
Yeah. Why are you in his butt?
He may not have wanted to go to those spots, though, again. You know, he may have
And where did that referral come from?
The pain clinic. The pain
Yes.
clinic. That
What
he
are
works
they
at.
doing?
The pain
Well,
clinic.
they do orthopedic pain management. So if you come in, you go, my back hurts all the time because I hurt my back. And they go, okay, well, we know a guy who fixes backs.
Yeah.
His name is Dr. Dipshit, and he's right over here.
Well,
But I mean, what?
No, they don't need to know that he's good.
Well, no, but I mean,
for-
like, what made them pick him over?
a lot of times clinics like that have like a Rolodex where they go, okay, we gave this name last time. It just goes out in like a circle, you know,
All right,
like
that
here's this name, then
I
here's
get
the next
that.
name, and here's the next name. But this is actually the first time when anyone tried to report him to the medical board. And it was the patient himself, Barry, complained to the medical board.
The patient had to do
The
it?
patient had to do it.
So
Yes,
we've
the
been
patient
through
had to do it.
2 hospitals, 3 boss surgeries, 15 years of incompetence, and now we're being reported.
We're being reported by the patient. There was an investigation into the case, and get this, the medical board determined that the standard of care was met.
Oh, my God.
That was so the medical
never going
board
to a
could
doctor
save
again.
face, though. That had nothing
That's
to do.
exactly what-
That
I
had
have
nothing
to
to
agree
do
with
with,
that. I have to
him.
agree.
So that they
But
could
that
avoid
makes it even
Unfortunately-
shittier, though.
So
I
they
know.
could
That
avoid
That they
a
want to
lawsuit.
save face.
Yeah.
That's even
Yeah.
worse.
It
They-
is worse, but that's
They want to avoid a
What's the
lawsuit.
name of the game?
Yeah.
And
Medical-
of course, retain
it's
that
expensive.
highly specialized caregiver.
He's not specialized.
No, he's
on
not.
paper.
He's
Con
not.
man.
Yeah,
is on paper.
exactly.
He is
I'm
yeah.
exactly
specialized on paper. I'll go write it up right now.
Yeah.
You honestly would probably be better at it.
It
than John.
sounds
probably
like
You
would.
can't spell.
No, I cannot spell.
I'll write
have
it for you.
Yeah,
It's
all
all
right.
right.
We're good.
All right, let's do this.
Yeah, I'll make $500,000 a year.
We're getting into the bigger part of it of the American healthcare system and what
Yeah.
we need to change about that.
You've reached the end of our episode. All suspects are innocent until proven guilty in a court of law. Join Raven next time on the Sirens Podcast.
Do we have an outro? That's our outro, isn't it?